Hello class, my name is Jacqueline Sanchez and I'm going to discuss my capstone project. I'm currently enrolled in health science. The class is 491, HSC 491. And so my capstone project is basically interviewing a medical doctor because that's the field I want to get into. I am so fascinated by patient care and helping those in need, and I just feel like that is my calling. And as a woman of faith, I was always taught to help those in need, and so I feel like that's the direction I'm going with. I currently work as a patient coordinator at a community facility. I have experience with private facilities such as Loma Linda Medical Center, and that's a private Christian hospital. And I've worked in private practice before. So I already have my feet wet in terms of patient care, insurance coverage, and so forth. But more so asking the physicians like in depth, like what they do, what their schedule is like. Personally, from my understanding, it's 4 years of undergrad, 4 years of med school, and depending the specialty that you choose, that's how many years of residency. But even if you want to choose a specialty, depending on what you score on your boards is going to tell you where you end up at. And so this is why studying is so important throughout medical school, because that's going to determine where you end up in the future, and that's why a lot of students are always stressed out and worried. But I recently lost my brother to sarcoma cancer in the nerves, and I was his caretaker for 2 years. I am extremely passionate about getting involved in that type of field, primarily in research, just because I know that this type of cancer runs in my family and I want to be able to find a cure. You meet so many great families in oncology affected by this terrible disease that I just feel that I need to go this route. As a good Christian woman, I want to give back. And so the capstone project has definitely inspired me and opened my eyes in applying my skills and how to brushing them up and how to make myself proactive towards my community and helping others. And it's been amazing by interacting. As far as the ins and out of a practice, applying my healthcare management skills that I've got as an emphasis under my degree, I've been applying them already, working at a community clinic, and it's heavy base. We see a lot of patients on the daily. We have a PA, we have MDs, and NP, PA, and a physician, and then there's DOs, obviously. There's a big difference. Only the DOs or the doctors can run a practice, not a PA or a NP. They have to run under the umbrella of a doctor. And so there's a lot of ways to branch out with this degree, and it's giving me the opportunity to, explore and find my passion in medicine. And so I am very grateful for Azusa Pacific to give me this opportunity to improve my skills and better myself towards a professional field. I've worked so hard to come this way, and I'm on the verge of graduating, and I didn't think this day would come, but I did. I've managed to push forward my education through my brother's illness, and I know that, God has a plan for me, and so I look forward to seeing what's the next step in my future. Thank you so much, and have a wonderful day.